they're going to look to you. They're going to look to you, the CIO, and say, you know, take all this data, and we're now connected. We're getting housing data. We're getting education data. We're getting all this data. I want you to make meaning of it. Where do you start?
Yeah, so I think the first place you start is with much better analytics than we currently have been applying, and analytics that's in the background and then presents prioritizations and succinct opportunities to the clinician, and not more than 3 at a time. And it's kind of like what I've talked about with the alerts. I don't want a ton of alerts. Keep it to a limited list. I'll work through them. If once I've addressed something, it goes into the system and it knows not to bring that alert to me again. Same with these opportunities and social determinants. My team and I, as a primary care physician, can work on the 2 to 3, and once we get them off the list, new ones come up. So better analytics in the background, a more seamless presentation to the physicians in the workflow, and then the big thing is it cannot be on the primary care physician or the specialist to implement a lot of the interventions. A lot of them are social interventions, public health interventions, societal obligations. So we can, as physicians, make the patients aware that they have these opportunities and point them in the direction. But our nation, our system, has to do a better job of providing those resources and making sure they're responsive to the needs of the patient. So but it starts with the analytics. And again, as I said earlier, it starts with the capture of the information, which is going to have to be largely from the patients, recognizing that we have a percentage of the population that is not literate and is going to need assistance. But the vast majority of us can enter the basic information about ourselves, those demographic and address type informations.